Hi, Kerri. Good morning. All right, so we are back to talk to you about how our lives changed from being active bedside nurses to not so active bedside nurses.
Exactly. And our paths, well, we didn't end up in the same place, but we started with the same situation. And that was, I said it last time too, maybe that was a little bit harsh, but we were both a little bit defective health-wise and born that way. You want to start?
So I functioned as for an ICU nurse for about a year and then transitioned to the ER. And then about 5 years in my career, I moved up to where I live now and started working there in the ER, working 12-hour shifts, 3-4 days a week, just like normal. And progressively, I started getting a lot of pain. And it wasn't just in one place. It was like several places. My back would hurt, and then my legs became numb. And I would go to doctor after doctor, and they couldn't figure out why I was having issues. And I honestly believe that some of them even thought that I was faking my symptoms for attention, or I don't know. But truly, I know that there was no physical reason they could find, but I was in so much pain. I would come home from work at night and I couldn't even pull the shirt off over my head without being in so much tears. And then I would try to slowly eke my way back to laying back on my back at night without trying to wake up my husband. And I'd have tears streaming down my face. I was in so much pain. And the only thing they could come up with was fibromyalgia. And
that doesn't go over well.
No, and chronic fatigue, which if you've ever worked in the ER, I don't know about other places, but in the ER, people see that and you get the eye roll right away. Oh God, not again. Because if they haven't experienced fibromyalgia and the fibromyalgia pain that really can come from it, they think it's fake. They think that we're just attention seeking and we're drug seeking and that's all we want is medication. But when I can't function in my job without medication, what am I supposed to do? But I didn't want to be on medication. I tried everything. I even got cortisone injections and tried physical therapy. I tried all kinds of things. And short of changing my career, I didn't know what else to do. So eventually I ended up deciding to get my master's degree so I could teach. And I did, and I liked it. But I still had this fear in the back of my head because when my mom turned 50, she was diagnosed with MS and Sjogren's, and she was no longer able to drive starting at 50 years old. And that number was creeping up on me. And I was like, what happens if I get to 50 and I can't drive to and from work anymore? So I ended up going on to get my doctorate so that I could continue to teach, because in the teaching world of nursing, you have to have your doctorate if you want to be an online educator. And so that kind of pushed me to get that. So
that makes sense.
I did continue to work some shifts in the ER. And like I said, I worked in Alaska the last couple summers and my body feels a whole lot better. And since changing careers and going on some of these activating supplements that we have, my pain is substantially better. I barely take Tylenol anymore, but I'm not going to lie, I miss the bedside nursing. Teaching is great, but hands-on care is always going to be a passion.
I agree. And my path was a little bit different. So I have a connective tissue disorder called Ehlers-Danlos, and I did not find out till I was in my 30s. I grew up and we laughed about it because we would say, oh man, we got some screwed up genetics from my grandma. Because as I was growing up, my knees would dislocate all the time, or my kneecaps would pop out and pop back in, and then you'd fall on the floor and people would laugh at you. And I was extremely hypermobile. My legs would just go all over the place. And then as I got older, I started having a lot of pain, and I had trouble with a condition called POTS, which is postural orthostatic tachycardia. So I'd get incredibly dizzy, standing up or moving quickly. My heart would beat really, really fast. And then I did okay until my 30s. I was very, very strong, had a lot of muscle mass, so it kind of held me together. I didn't realize this was what was going on. And then I ended up just falling on my butt. That's all it was. A small fall back on my sacrum, and it separated my sacroiliac joints, which are the little wing joints at the back of your hip bones that connect your pelvis together. And I hurt some discs in my back. And I did PT and injections and all kinds of things. And for about 1.5 years, I was able to keep working. And then one day I was just standing at the nurse's station and I felt like somebody shot me in the back. And I was in agony for a full year. And it was so bad. I just laid around and cried. And I can take a lot of pain from being in pain for a lot of my life, just dealing with it, not realizing that was abnormal. But it was very hard to deal with. And we'll talk another day about what it's like to lose your identity as a career. But couldn't go back to work. And after that, things started to really slide because when you're not doing anything, you start to lose muscle mass. And as someone with a joint problem or a connective tissue disorder, when you lose muscle mass, things get more sloppy. And that was the road to starting to have more and more health problems. And I discovered that I was diagnosed with Ehlers-Danlos before I got injured. It was while I was working in my 30s. But I found out that you can think of that as an umbrella. And under that umbrella are all these other issues that can come along with it, like the POTS, thyroid disorders, severe migraines, intestinal problems, female problems. And you check the list, and I was meeting all of them. So I started just falling off the cliff there. And I've had so many surgeries, I couldn't even give you a number. I think it's 17 or 18 if I had to guess. I ended up living in a lot of pain all the time. We tried surgical implants in my back, disc surgeries, ablations, injections, many, many things. When I moved up to where I live now, which is in Appleton, Wisconsin, near Green Bay, we have a great pain clinic and they do phenomenal things for me. But if you're in chronic pain, they get where they're excited about finding something that reduces your pain by 5%, because it helps you get to the point where you can get your head around the pain and say, okay, and you know how that is. You're like, okay, I'm enough that I can mentally manage this, or 10% is amazing. And then I couldn't go back to work, and you're able to do something I couldn't, because I got to the point where I couldn't sit, couldn't bend, couldn't stand. I've also had my knees reconstructed twice, have a lot of trouble in there, couldn't twist, couldn't lift. So I had all those restrictions. And then I was on so many medications and I had such bad brain fog. I wasn't safe to think, even if I was going to try to. So I couldn't safely do something like telehealth, because not only could I not sit in the chair for a great period of time, but if I were watching, I can't safely all the time make sure I would pick up what was going on. And I have good times and brain fog times. And I know I was homeschooling my kids, and I would get in significant arguments with them about math, because I would be positive I was right. And my son would be like, Mom, 6 times 8 is not 72. And I'd say, yes, it is. And we would fight and fight. And then 20 minutes later, I go, okay, you're right, because my brain would clear up. So clearly you don't want me dosing your heart medicine when I can't math crap. So now I just say, sorry, I can't math. And we let it go at that. I also lose things all the time. So anyway, we got to the point, like, lose my train of thought, point me back. Oh yeah. Where did I go from there? Well, I went nowhere, no work, couldn't do that, couldn't do anything, because, and I'm sure you have this issue too. I would get up in the morning and I'm having a great day. I feel wonderful. 2 hours later, I'm in bed because I feel like crap. So you can't plan a day and think you're going to do something. And other days you're phenomenal, and you can get up and you can think and you can feel good. And I say phenomenal within the realm of I can walk around and do things in the way that I'm able to do them with my body, modifying things.
It's hard though, because there's so many times where, like, I'll go, like, for example, my cousin, love her dearly, but she want to go to the state fair, for example. She loves fair, but we will go and she wants to get there the minute it opens, and she wants to stay until the minute it closes. And for anybody that has any kind of issues with chronic pain or chronic fatigue, you know, by halfway through the day, I look and feel freaking exhausted. My body hurts. I'm tired. I can't think straight. And I'm like, okay, can we go pretty soon? Oh, no, you're fine. I'm like, the heat's making me sick. I'm really tired. I need to go. And she's like, oh, no, you're fine. And you feel bad because you want to make the other person happy. You want to be there. You want to participate. You don't want to be the poor sport who doesn't do things. And I feel like that's who I always am. Like, Alice is out partying and having fun, and Kerri's the one that's like, I'm going to go take a half-hour nap. I'll be right back. Because you don't want to miss out. You got that little FOMO in them, right? No one wants to miss out. But I always feel like that's part of my, I'll call it a disorder. I don't know. Is that I'm always the
hidden
one.
disability.
Yeah. You look at me, you don't notice the fact that I'm in pain. You don't notice the fact that I'm tired all the time. or, do get some brain fog sometimes. And even in class, a few times I've sat there no, I should say something, but I can't get the words out. And I am glad that one of the products that I've been on has helped with that. And so I do feel like I'm finding that brain fog to be decreased, which is
phenomenal.
It's very helpful. And you feel a little less incompetent when you get that way, because there's nothing worse than sitting in front of a classroom full of kids and they're just staring at you like, "Come on, Dr. Bustede, what do you got to say?"
And then detour over. But since I've started on the products, and we'll kind of circle back around, I never would have been able to do this job until I had done that, because now I can connect thoughts, I can have conversations, I can learn about what's behind them, and I can explain them, and I can get past the brain fog.
Which is amazing.
Yeah. State fair prep. You just were going to say that real quickly. What? So if you're going to go somewhere real quick. So here's my state fair prep. Somebody wants to do something that's a big event. So I get ready. I put some KT tape on my knees. I throw on my knee braces. I put on my back brace. I get my Midodrine to make sure my blood pressure stays up. I do ice vest so you don't get too hot and then pass out. You put your walker in the car in case things get really bad. Park in the handicap spot so that at the end of the day, you can make sure you can get to your car, because when you're too tired and you're absolutely done, you realize you parked too far and you can't actually make it back to your car. You take your pain pills that you save for the day that you have to walk.
By the way, parking in handicapped and looking like we do at the moment, people look at you like you are absolute fools. Like, rude of you to park in handicapped when there's more needy people than you.
Yeah.
Admittedly, I don't need a handicap spot at this point, thank God. But Julie and I went somewhere together and parked close, and we talked about that. We looked like two perfectly fine individuals walking out of the car, but by the time we walked back, you're both in pain and hobbling, and certainly hard because people can't see it on the outside. So we don't always know what people are going through, and that is a hard part about this hidden disability thing.
Yeah, we both have been there where you push yourself too far at an event, and then you realize your car's half a mile away.
Oh my God.
And then you go, how in the hell am I going to get back?
And when you're an event like that, we were at a huge craft fair, which I love to go to. But, you have 3 armloads full of crap that all seems to weigh 10 times more than it really does, because you're in so much pain and you're tired. And now you have to carry it back to your car, and it's miserable.
Or you don't know where your car is.
That happens.
Not that we would have done that.
No.
So anyway, I got to the point where I needed a new career. I didn't work for a long time. I ran into these products, and they changed my life, and they gave me a career.
So let's spend the last couple minutes talking about the product. But what I want to know is, how does it feel to go from being a nurse to being the patient?
Oh, geez. That's a whole nother podcast.
It could be, but we got time. Let's chit chat.
So
let's talk about it a little bit.
Okay. So let me tell you, I always tried to tell the people that I precepted that you can't make judgments. Do not make value judgments about people. Don't judge their pain. Don't judge the situation they're in, because I felt strongly about that. But becoming a patient who had a lot of medical needs, you get treated like people make all kinds of judgments based on your diagnosis. And it's the worst place you ever want to be.
What do you mean?
Like the place you want to go least in life as a medical person.
Oh, to your own hospital, to the doctor.
To the ER.
When you work in the ER, you really don't want to end up in the ER.
Because I can guarantee you, if it doesn't matter, I better be nearly dying before I go to the ER. They're going to treat you so poorly there. And please don't take offense, ER, who are watching you. Maybe you wouldn't do that. But I have never, maybe one time since I've gotten sick, been treated compassionately or respectfully in the ER. You come in with a chronic pain condition, they think you're a drug seeker automatically. You come in with any kind of my drug list is 2 pages long. Do you think I want to take that many medications? No, there's nothing there we can take off.
Oh, for sure. I went in with COVID symptoms, like post-COVID symptoms. My temperature was high. My oxygen level was low, like the 80s low, which is unusual for me. And my heart rate was, not kidding you, 170. And the PA that took care of me, who was a friend of mine, saw that I had chronic pain issues and that I had a pain medication on my medication list. And that was my discharge instruction. That number 1 was how to get off pain medications and opioid addiction. Like, I'm not addicted to opioids. I take 1 tablet once a day as prescribed. Could you help me with my symptom that I'm here for? And I did. I struggled with
Near-death experience?
Well, I didn't have near death, but
I'm just kidding. Well,
but
heart rate in the 170s
yeah,
and oxygen in the 80s. I bet he was septic
bad.
or whatever.
And, did fine. She did a full workup, but the whole fact that somebody who knew me that intimately, because we worked together for several years, that was still their focus, was the medication that was prescribed, and I was taking it as prescribed, and I didn't ask for any pain medicine. I'm like, my heart is racing and I cannot breathe. Please help me. Something's not right. It's sad to me that that was the focus of her thought process. I did get IV fluids. I did get medication to help bring my heart rate down. I got nebulizer treatment. So I did get some of the right stuff. So don't get me wrong. And
but
if
the focus still has to be
the person ever watches this, I don't blame you. And I don't take the medication anymore. I was able to get off of it. Thank you. But yeah, just that whole idea of judgment before you walk through the door.
And the other thing about when you are in a lot of pain all the time, don't expect us to be writhing in pain all the time. Because if we were writhing in pain when our pain was a 7 or an 8 all the time, all we would do is lay on the floor and writhe in pain. You manage to find a way to cope in your head so that you can handle it. So by the time we're writhing, things are really damn bad.
Yeah, I admit it. I'm guilty. I'll admit it. I've had people come through the ER. I've triaged thousands of people. And when I ask somebody, so on a scale of 0 to 10, what's your pain? And they're doing this. Oh, I'm an 8. And they're like on their phone. They're too busy to talk to me because they're talking on their phone, or they're doing other things or giggling with their kids or whatever. To me, that's not an 8. But more and more I got into this pain problem, maybe they were at an 8 and I was just prejudging them. And that is a hard part. If you're not struggling with these issues, you won't always understand.
Yeah, certainly. And the other thing, and I think we'll come into this too, but it's not just pain, but it's also mental illness, because I am bipolar. And there were years I wouldn't put it on my chart. I wouldn't even get treated because the stigma of that is huge.
Absolutely.
So I had depression on my chart, but I actually needed treatment for bipolar and I wouldn't go because as a nurse, I was afraid at some point I would end up in one of my own facilities and they would see that. And I know because when you give report to other nurses, how many times have you given a report? Because at report, you hand off to another nurse and they stand there and they read the chart and they give all their report, and then they get to that part and they take this and this and there, and then they start to make fun.
And they're like, oh, yeah.
Nah.
Okay, I'm a type patient because they are on these 6 meds. Well, sometimes you need those 6 meds.
Yeah.
So what do you think as like the family member or as the patient is some of the worst things that a nurse or somebody else has done or said that you had to like with?
To me or to them?
Like to the patient. Like I remember specifically having pyelonephritis, and
that's a kidney infection.
The nurse came in to give me a shot. And if you've ever had a shot of penicillin, let me just tell you, it hurts like a son of a gun because it's thick and you have to use a big needle and it has to go in your butt. It has to go in a big muscle. And this nurse came in and she wanted to put it in my arm. And I was like, absolutely not. And she's looking at me like, what are you talking about? I said, I don't like to tell people that I'm a nurse when I come in as the patient, but I've been a nurse a long time and you are not putting that shot into my arm. And I totally offended her. But I have to stand up for myself because I do not want thick, painful shot of that much medicine going into my arm.
You can't put it in the arm. It has to go in the butt.
And so I know that I insulted that young lady, but I find myself doing that, like to stop people. And I don't know if it's the educator in me, the nurse in me, or just my personality. But there's so many times where I'm at the bedside of my mom, my dad, my mother-in-law, myself, my neighbor, and I find myself correcting those nurses or healthcare workers or saying things to them like, do you want to recheck my dad's blood pressure? Because it was a little low last time.
Yep.
But it wasn't that low.
I have a lot of small ones, but I have 2 big ones. My daughter multiple times has had what's called plasmapheresis. It's a form of dialysis. And so she would have a dialysis catheter in her chest. Those are massive catheters and they lead straight into the heart. And it turned out it was actually the head of the dialysis unit, the charge nurse. and she had contaminated the IV bag. And so she needed to go downstairs and get a fresh IV bag. So she disconnected all of the tubing down to the major connection, unhooked it, and left it laying there, open to the air for 30 minutes. And then she came back up and she went to hook back up to Alex again, my daughter. And I said, "Whoa, what are you doing?" And she's like, "The bag was contaminated. I'm putting it back up." I said, "You're not hooking that tube back up. It's been laying there." She said, "It didn't touch anything." I said, "It's been open to the air and you're going to put it straight into her heart?" "No, you're not. You're going to run a fresh line."
If you haven't seen it, you don't know if somebody around it has sneezed on it, coughed on it, or what's in there.
The bacteria from the air just landed on it. And that's how people die. They get septic from bacteria in their blood.
Absolutely. Yeah. I'm sure that people see nurses as family members and they're like, you can take this patient. I'll take the next one.
And here's a good one too. This one will make you laugh.
Oh boy. Do tell. I want to hear.
My daughter couldn't get an IV line when she was in the hospital, and she had inflammation of her brain. So it was called encephalopathy. Admittedly, she was nuts. And they should have called and got an IV in an arm, but they needed one. So they put it in her breast. Okay. Then what do you think they tried to run in there? High dose steroids.
Oh.
She started to scream that it was hurting. Now she was nuts. So they told her that they didn't believe that it hurt. And I said, "Stop. What are you thinking? Of course it hurts." I just came in and walked into it. Mm-hmm. And some meds are just very toxic. And this vein here branches into many veins. You can see it on your chest when you're in there. It branches into a whole bunch of little mammary veins there. And so it's like you're taking this very caustic chemical and just branching it out into lots of veins and then trying to tell her it doesn't hurt.
Yeah.
One was awesome.
I think we were talking about this last night, but one of my memories of being pregnant with my son was that I had hyperemesis. And anybody that's gone through that, I feel for you. But I had that with both my kids, but this one in particular I remember, and I would end up in the ER at IV fluids and get rehydrated so that I can hopefully take care of my daughter until the next time I got so bad I had to come back in.
That's super vomiting. It's like when you're nauseous, but you puke and you never stop puking.
She's my interpreter.
Yes.
Anyways, so I was there and they hooked up the IV fluids and then the doctor ordered 2 medications. One, which is Benadryl, which we're all familiar with. And then the second one is an anti-nausea medicine. And so the nurse takes and literally pushes in one drug, pushes in another one, and walks away. Well, if you know anything about nursing and medication, you do not push medications in that fast. They need to go in over a minute or two, or you can have side effects. I always joke with my nursing students that if I ever took LSD, that's what I would expect it to feel like. I've never done drugs. I don't want to do drugs. I didn't like the way it made me feel. I felt like I was floating in the air. I was grabbing onto the side rails for dear life. And I was like, dear God, don't ever let somebody do that to me again. And then a couple years ago, I was taking my neighbor to the hospital for pain. He was at a gallbladder attack and they did the same thing to him. They're like, "I'm going to give you this pain medicine, but here's a nausea bucket just in case because you're probably going to throw up." And she shoved that medication in really fast. I was like, where are these nurses getting training that they do not know? How do you not know that you need to run medications over a certain amount of time?
Yeah.
Medication has a certain prescribed amount of time to go in. And it's not like, I just suggest you should give this over 2 minutes. This is like, you need to give it over 2 minutes. So yeah, as a nurse, it's very painful to watch when somebody does that to either myself or somebody else.
And I think that's the part of being someone who has illness. And I have compassion, but when someone in healthcare gets ill and have something the first time, I always kind of want to go, now, they don't do that again. Once you've had an injury, once you've broken your leg, once you've done whatever, you treat your patients so much better when they've had that happen because all of a sudden the things you thought aren't true and you realize it.
Yeah.
But there's a med they give for migraines, and I think it's Compazine. And you may have heard this before. But when you push it too fast, all your lady parts and your nether regions and all of your mucous membranes start to burn like they're on fire. Doesn't happen if you've never heard that?
No.
Oh, God, yeah. It comes over you like a wave of fire, and it lasts a couple minutes. And I've had someone tell you, too, you may have that. Well, you don't have it if you push it slow. You don't have to suddenly feel like you've been a light. It's, yeah, one's another unpleasant one. So just if you're watching and your nurse or
Or
doctor
med tech.
or you name it, just please pay attention. It matters to your patients. And if you ever become a patient, you don't want to be treated like this. So be more aware of the things that you say and the way you treat your patients, because we don't want to be in this situation. Nobody ever wanted to end up in this situation. It's not like we got up one day and said, oh, I think I'll become chronically ill with a whole lot of diagnosis and tons of meds so I can be treated like crap by my healthcare providers. Does that sound like fun to you?
No, both my parents are going through a lot of medical issues, as well as my mother-in-law. And so I go to a lot of the appointments with them, or I'm on the phone with them. And of course, the very first thing they say is, this is my doctor. My daughter, she's a doctor of nursing, which they don't explain the fact that I have a PhD. So I educate. I'm not like a nurse practitioner, which love them, but didn't want to be one. Of course, part of that too is the whole pain thing and not feeling like I could do that. But anyways, so of course, every person feels like they have to kind of cautiously around me, but they do take the time to educate me, which is good. But at the same time, if Julie's the patient, talk to Julie, and then I'll help translate for her if she's my patient, right? Or my family member. But it is interesting the way that people perceive you differently, knowing that you have that background, and the way that they talk to you and the way that they work with you, versus just being in the room and being like, oh, this is my daughter, Kerri. And then they may not explain things well, or they may not go into as much depth.
Or be honest.
Or, be the background. And I feel like them saying that, I hate it, because I feel like I don't want that special treatment. But then I feel more able to ask some more in-depth questions without looking like a real pain in the butt. It's more like, hey, I understand the situation. Now give me the background. Give me more information, because I need to know.
Yep.
I think this one wasn't quite as much funny as our others.
It was
maybe
kind of depressing.
I know, I'm sorry. But brain fog is definitely something that we both struggled with. So what is one product that you think that we have that would really help with that?
Well, there's a couple, but I think the primary one is the Axio. So it is an energy drink that actually works with your neurotransmitters. And we have it in lots of flavors. We have it in both decaf and caffeinated. And so I find that I think it's the same time of day as you, between like 1 and 3, but for me it normally hits about 2 o'clock in the afternoon. I get really fatigued and I need a little pick me up for energy, and it does that. But I normally take one in the morning and I take one in the afternoon, because I found that my brain fog is so much better. It just has helped connect my thoughts. It's helped me. In the past, what I've had is, you talked about this in your class, the thoughts are here, but they will not come here. They're jumbled. I used to be able to be so good at Trivial Pursuit, but then the words would be in here. I'm like, time that guy in history did that thing that, everything can come out again. It's not frozen in there.
We talked about how Axio also helps a certain population of people who have another mental health disorder. It's mental health, ADHD.
Yeah. It can, well, what we'll say is we can't say it treats, prevents, or cures disease. What we can say is we have some good testimonials from people that have ADHD, including my fiance and my son, who they have said, both of them, is it quiets the squirrels in their head. So it lets them calm down and be a little more organized. And so that, they say, feels a lot better after they take their Axio, and they take it consistently each day, is that it helps, in some sense, it helps even more than his ADHD medication does. So it just helps you.
Amazing though. I mean, just for myself, when I drink it, I can sit down at my computer and focus on my work for a couple hours straight and not have all of the racing thoughts of other things in the house. So I used to sit down and I'd get a little bit of work done. I'd be like, oh shoot, I got to go change the laundry. And then you change the laundry and all of a sudden you notice the dishes need to get put in the dishwasher. And then you start putting dishes in the dishwasher and you realize that you forgot to send an email. And then you walk back and you start sending the email. And then you're like, oh yeah, right, I was working on this project. And then you start working on that again.
You're me.
I know, we are one and the same. But when I take the Axio, I do find that I can sit down at my computer. I know what I need to do, and I can sit there and focus on it for 2 or 3 hours straight and not feel like I need to do 10 other things. I can keep my mind focused on that one project. And to me, that's life-changing.
Yeah, it tastes good.
Well, yeah, there's that. I like that too.
So, and it's a lot better than drinking because it's all natural. Everything in it is completely all natural. There's no artificial flavors or ingredients. So it's good for you.
And you can get it in caffeine free too. So if you don't like the caffeine, you can have it that way as
Don't
well.
have to have it.
So I think we'll play a little music for you. And next time we will come up with something more fun so that we'll have a little more giggles and laughs and not just serious talk. But
what else? If you have chronic pain, please give us a little bit of suggestions in the bottom if you think that you had your own experiences.
All right. Have a good day.